Common question we get, hey Dr. Joe, when do I need a facelift? Well, if you're asking that question, you probably need one. You have to remember that all cosmetic surgery is elective. Nobody ever died because they didn't have cosmetic surgery. So the question is, when do you need something? Well, you know, some patients have psychological implications or body dysmorphic problems, and you know, we have 19-year-olds that come in and request a facelift, which is obviously out of the question. I think all of us, after we get into the 40s, 45 or so, we start to see jowling, we start to see extra neck skin. Our heredity has a lot to do with it. So some patients at 42 may have the aging of a 52-year-old. In my experience, it's from 45 on up when you really start to see these areas. So a patient that's really in their early 40s, they may need one of these small short scar facelifts. And out of about 90 facelifts last year, I did one of those. Again, I don't do many of them because most people need more. And on the cases that I have done that are these small facelifts, when I go to pull the skin, I'm always amazed how much skin they have. So if I'm going to do one of these small weekend facelifts, I ask the patient to give me permission to convert it to a regular facelift if I think I need to, and usually you need to. So we may be doing that really small lift on somebody that's in their early 40s, kind of a medium lift or mini lift on somebody that's from 40 to 50, and after 50 most people need what I call a comprehensive facelift. So the difference of these lifts, it's really the same incisions and the same procedure. It's just how far you go, how far you dissect, how big your flaps are. So it's a little bit more aggressive the older you get. So who should do your facelift, and what type of setting should a facelift be done in? Well, first of all, the first answer is easy. Anyone who is a qualified specialist with facial training would be a good person to do your facelift. First of all, don't buy the thinly veiled self-serving statement that you should only see a board-certified plastic surgeon. I have a lot of great friends that are board-certified plastic surgeons, and some of them have a lot of cosmetic facial surgery training, and many of them have very little. It's not the specialty that's important, it's the training that a person has. So who does facelifts? Well, plastic surgeons do. ENT surgeons do, ear, nose, and throat, facial plastic surgeons, oral and maxillofacial surgeons, dermatologists, oculoplastic surgeons, and other specialties. So there are a lot of different specialties that do facelift surgery. So what's important about the provider? Well, what's their training? What's their specialty? What's their facility? How many facelifts do they do? Anytime you go to have a cosmetic surgery, if a surgeon can't show you 100 before and after pictures for a given procedure, then they probably haven't done that many. And again, when I first started doing this, maybe I had 3 or 4 or 5 pictures. But after a while, if you know, I've done almost 1,000 facelifts. It's my favorite procedure, and we do several a week. And so a surgeon should be able to show you their work, and that's important. So training, outcome, their facility, their availability. You know, I give everybody my cell phone and my email, and I tell patients, if you can't get in touch with your surgeon, you have the wrong surgeon. So there are many things to consider, not just somebody's what board certification they have or what specialty they are. I think it is important to have a board certified surgeon do your surgery. My original training is oral and maxillofacial surgery, so I spent years and years studying the face, and all my surgery is from here to here, and that's my expertise. I don't do boobs, bellies, and butts. I'm a face guy. The other part of this is what setting should a facelift be performed in? Well, if you walk into somebody's office and they're going to do a facelift in their exam room or in a regular non-surgical room, you need to be very leery about that. We do our facelift in our fully accredited facility here. This is done in sterile technique, the exact same way it's done in a hospital. And we could be doing heart surgery because we're sterile. And we have the latest anesthesia equipment, the latest emergency equipment. We are essentially an office-based hospital, and we're held to very similar standards as the local hospitals because of our accreditation. So make sure, if you're having a facelift, that you're doing it in a clean, sterile, safe facility with with adequate anesthetic skills, personnel, and backup, and the same thing for emergency equipment. With any surgical procedure, you have to discuss complications, and I always tell patients when they come in that they're going to read our informed consents, and it's probably going to make them nervous because when you talk about facelift surgery, there are a lot of significant complications that can occur. Fortunately, these are very rare, and if you go to somebody who's an experienced facelift surgeon who's done hundreds of facelifts, they're going to tell you that they see all the common complications, little scars, little suture abscesses, areas that need a nip or a tuck, but significant complications like severe anesthetic complications, motor nerve damage where you have a muscle or part of the face paralyzed. Things like this are extremely rare, and most facelift surgeons won't experience that. Fortunately, most of the complications that can occur with facelift surgery heal up well, or they can be treated. So doing 90 facelifts last year, probably 2 or 3 patients, we went back and did some lasering on their scars, maybe did a little nip or a tuck on a little excess piece of tissue. It is a good thing, and most experienced facelift surgeons will tell you that complications are pretty rare. Severe complications are almost unheard of. It's for this reason that if a patient is concerned about complications, I like them to talk to some of my patients that have already had facelift surgery, because what most people fear is really not the complications, because those are really rare. They fear the whole recovery and the surgery and everything. So it really puts them at ease to speak with other patients. And let's talk for a second about recovery. So it's rare that I do just a facelift, because most people that are old enough to have this are old enough to have this, and we're doing other procedures. It's really common for me to do facelift, eyelids, full face laser, and facial implants or brow lift. So sometimes we do 4 or 5 procedures, but most often we're doing facelift, eyelids, and laser. So the more procedures you have, the longer your recovery. When I do a facelift by itself, these people do quite well. One thing is I don't use any drains in my facelift or any dressings. I do put a little vent in overnight, and I put a little elastic dressing overnight, and then the next morning all of this comes off. So that makes that experience easier, because some patients have to walk around with big tubes and drains for a week or longer, and a big dressing like a football helmet for a week or longer. I think that's completely unnecessary, and I published this recently in the Journal of Dermatologic Surgery. Just don't think you need that, and I don't use them in my practice. So what really steps up the recovery is when you have full face laser resurfacing. When you do a facelift, that's like rebuilding a car, doing body work, and you're fixing all the body. And then when you do a laser resurfacing, that's like painting the car. So the laser does a lot, but it really bumps up the recovery. And I've had a full face laser myself, so I know what it's like. And it just makes for a little bit more aggravating first 5 or 6 days, not because it hurts more, but just because you're more swollen and your skin is goopy, and you have to keep Vaseline on your face, but it does a lot. Although some surgeons don't do laser and facelift at the same time, I do laser and simultaneous facelift on about half of my patients. So that is proven over the years to be very safe and effective in our practice. So the more procedures you have, the longer your recovery is. What I tell patients is our average patient can return to work in about 2 weeks. Now, this isn't 2 weeks before your class reunion, okay, or the big dance. This is 2 weeks before you can kind of sneak back into public. And if somebody is doing a facelift in anticipation of a big event, such as a wedding or something like this, I tell them to give themselves 4 to 6 weeks, because from the time we do the lift, 2 weeks is the initial recovery when people kind of go back to work or back to play. 4 weeks, they look a lot better. 6 weeks, they look better. I don't even take my final pictures till 90 days or 3 months, because you have these small, subtle changes that are going on. So in my practice, I tell patients, plan on 2 weeks. When can I work out? Very common question. Really, you could start working out the second week in terms of walking or lightly walking on a treadmill. In about 2 weeks, maybe you can return to the gym at about half speed. The thing that we don't want you to do is any activity where you're going to be really stretching and pulling on those facelift sutures. Okay, so golfing, bowling, yoga, aerobics, anything where you're going to be doing that, you really ought to give that 4 to 6 weeks. Caregivers. This is a huge word, and if you go to my website, lovethatface.com, and look at the recovery instructions and the consents, that page, I have a lot written on caregivers. This is one of the most important things, and sometimes patients will come in and they'll say, oh yeah, I have a caregiver, my daughter's going to take care of me. You can't have a 14-year-old taking care of somebody that needs intense help for that first 24 hours. You're going to need somebody that is credible enough to manage your medications, somebody that can assist you in and out of your house, on the way from our office back into your house, somebody can assist you to the bathroom, assist you with hygiene needs, assist you with basically everything, because depending on what you do, you may be out of pocket for 1 to 2 days. So if you don't feel that you have somebody that is really versed in being able to take care of you, and this is saying nothing against your family, because we have some wonderful husbands and children and relatives that make great caregivers, but we have some that are just shocked by the whole thing, and they don't make great caregivers. So you want to line this up. If you don't have somebody that you think can really do the job, believe me, it's worth the small expense to have somebody stay with you the first night, or at least the first couple hours, and our office can arrange this. Sometimes you have somebody with good intentions, and they come in the recovery room and they see you, you're swollen, your skin is burnt, your eyes are swollen, you have a bandage on your head, and it just, they get very emotional, and it's hard for them to be strong for you. So a caregiver is extremely important. If you don't think you have the right one, we'll find one for you. This series has been informative for you, and I hope that we've given you the truth about facelift surgery. If you're interested in having me do your surgery, it would be my honor. You can contact our office by dialing 804-934-FACE, 804-934-FACE, which is 3223, or contact us on our website, lovethatface.com, or email me at nyamtu@nyamtu.com. Cosmetic facial surgery is my passion. Facelift surgery is my absolute favorite procedure, and I would love to do yours. This is Dr. Joe Nyamtu. Please take a look at The Truth About Facelift Surgery Part 3, the next series, which shows actual facelift surgery in high definition, step-by-step videos. Thank you so much for your time, and I hope you look at the next series.